Hi guys, Dr. Amin here. Hope you are well. I get a lot of questions from GP training saying, what do I do in pediatrics? How can I prepare for a pediatrics rotation? So I want to talk to you about 8 things that I learned in my pediatric rotation as a GP trainee to try and help you get the most out of your pediatric rotation. Now, I did my pediatric rotation at Sandwell Hospital in the West Midlands. Great hospital. I was under great consultants. By the end of pediatrics, I loved pediatrics, but at the beginning I was daunted, I was worried, I heard a lot of stories about difficult situations that you get put under in this rotation. So I want to share with you 8 amazing things that I learned to set you up for your own pediatric rotation. So the first thing I took away from my pediatric rotation is that by the end of my rotation, I generally got comfortable in handling children, examining children, talking to children even. Now, this might seem a really odd thing, but I'd never really been around kids before my pediatric rotation. And I was worried about this. I'd never really held a baby. If I think back to that time, I've got 2 kids now. I know how to hold babies now, but I didn't at that point. So the first thing I got out of my 4 months is that I became comfortable in handling pediatric patients. I've seen a lot of adults before, of course, but never children. So the first thing you're going to take out of a rotation in pediatrics is you will come out comfortable. Now you need to be, because in a career in general practice, you're going to see a lot of kids and getting used to how to examine them, how to hold babies, how to do things the right way, and not just learning the right way, but doing it enough times so you feel confident enough to not worry about that part of it, so you can actually focus on doing a proper assessment and getting the information that you know. So the first thing that I got out of my pediatric rotation, and this is probably the biggest thing, was that I became comfortable in assessing babies and children because I just hadn't really been around them before in my life. Now, the second thing I got used to in my pediatric rotation is little tips and tricks. This follows on from the first one of how to examine a baby or a toddler or a very young child. Now, I was obviously very used to adults, saying, can you please open your mouth? And can you sit in this particular way? And can you let me listen to your heart sounds? Now, of course, a kid doesn't think about this, A, because they're a kid, and B, because sometimes they're very unwell and it's difficult to get things done, like looking ears and looking mouths. And these are things that you need to do quite a lot in pediatrics. So one thing I learned is little tips, little tricks to allow me to do this in a way that was comfortable for the child, to almost distract them from what I was doing, and not just tips and tricks to allow me to do the actual physical examination, but little tips and tricks to get the parents to help with the examination. So what kind of things can I ask the parents to do to allow me to do an examination in a certain way? These things were invaluable, and I would never picked up these things without trialing and erroring lots of different things, getting things wrong, realizing what works and what doesn't work, and without doing a pediatric rotation. So the second thing I took out of my 4 months of pediatrics was little tips and tricks, both for examining a child directly, but also things to say to mum and dad or parents or whoever was there with them to allow me to do a decent examination to try and help them in the way that I wanted to. Number 3, now I'm a parent now, but at that point I wasn't a parent. And one really important thing that I took away from my own pediatric rotation was the ability and understanding the power and the need to reflect parental anxiety back. Now, I remember seeing lots of little babies and thinking, well, they're fine. Like, I've done an assessment, there's nothing wrong with them. Don't worry, just like I used to do with an adult. But actually then you realize the parent is often extremely worried. Even they may have never seen their little baby have a temperature before. They may have never seen their child have a cough or a particular type of cough before. They may have never seen their child fall over and have pain in their arm, for example, to such an extent that they've brought them to hospital. So reflecting these anxieties back, taking the extra time to recognize, acknowledge the worries, answer the extra questions, go the extra mile and say, look, is there anything else I can do to help you? Those things were invaluable in allowing those consultations and those assessments, whether it be in A&E or PAU, to be as effective as I can. Because one thing I learned in pediatrics is if you don't get to the stage where A, yes, you've assessed the child, but B, you've made sure the parents are happy with what's happened and they've got all of their queries out, it goes back to ICE, we talk a lot about the kind of consultation skills, then the parents often left, and you could tell when they left not fully satisfied. So it's really important. And one thing that I learned in pediatrics was the real importance of making sure you reflect anxieties back to the parents and you answer every single query that they have and you take the time to do it. The fourth thing I got used to, that I'm actually really thankful for doing a pediatric rotation to help me do this, was getting used to pediatric values. Now, pediatric values are obviously very different to adults, and they vary from age to age. They vary from weight category to weight category. And when it comes to things like assessing a child, looking at respiratory rates and heart rates and these kind of things, I had to get used to trying to A, do the examination, then B, look at the table and see what's right, what's the range that fits with that age and that particular weight. And then also prescribing. Of course, with an adult, it's fairly consistent in terms of what you prescribe in terms of doses. You get used to doses very quickly. But with pediatrics, every single situation is different. You have to look at the age, you have to look at the weight. So this is something that I'm really grateful for my pediatric rotation in giving me experience of doing. So when I went into my GP rotation, I didn't have to spend ages being not confident about doing this. I was just very quick at doing it. I knew what to do, and it didn't hold me back too much. So one thing I would put in your PDP, if you're doing a GP, if you're a GP trainee, you're doing rotation in pediatrics and you're wondering what should I do for a PDP, put this down. Get used to pediatric dosing, get used to pediatric assessments when it comes to examination. I found it invaluable, and I'm sure by the end of your rotation, you'll find it really invaluable as well. Number 5, the 5th thing that I took away from my pediatric rotation was attending pediatric specialty clinics. This was amazing for me and an eye-opener in terms of how to deal with things when I went out into the community. 3 stand out to mind that I took so much away from. A pediatric allergy clinic, I took a huge amount away in terms of tests, what's available, how to manage things, and just how to reassure sometimes. Secondly, pediatric asthma clinic. Huge differences between adults and pediatric in terms of asthma, steroid doses, when to start things, the guidelines are different. I got so used to that with going to a couple of clinics. And number 3, pediatric dermatology. This was amazing for me because I got to see all those common things that I got to see again in a few months' time, but I just had a better understanding because I'd seen how they're managed firsthand in secondary care. So there are many others you can go to: pediatric cardiology, pediatric gastroenterology, whatever you think might be useful. I found those 3 really useful, and I felt much more confident about handling those things in the community a few months later. Again, if you're worried about PDPs, put these on your PDPs. Go to a pediatric asthma clinic. Oh, I want to attend a pediatric allergy clinic. They're great for your development as a GP in the future. And if you're struggling with PDPs in general, go to the website auroramedicaleducation.co.uk. Look at the blog, the GP training blog that we have. We have a list of PDPs, not just for pediatrics, but for all rotations, things that you might want to think about doing when you're doing them as a GP trainee. The 6th thing that I took away from my pediatric rotation was that I had to trust my gut instinct when it comes to an unwell child. Now, sometimes kids look well, right? They're playing, they're doing various things, but actually when you look into it in a bit more detail, you realize that actually can be quite unwell. Kids are quite resilient up to a certain point. And one thing I learned was to not ignore my gut feeling, spotting the sick child, seeing which one needs help straight away. Those kind of things, you can sometimes make a decision there and then. And it may go against what you're physically seeing, but your gut instinct is telling you something different. And I remember talking one day to my registrar at the time, who was a registrar in pediatrics then, probably a consultant or professor or something right now. But they told me the same thing. Look, when you see a child, if your gut feeling, firstly, the fact that that child's been brought to hospital means that there's been a gut feeling happening probably from a parent. Like they just know there's something not right, so they brought them in. So you can never disregard the parental gut feeling. But then if you get a gut feeling that you're not quite happy about a child, for whatever reason it might be, do not ignore it. Now, this became really useful for me when I went into the community and did my GP rotations, because again, I always went back to that. If my gut feeling was not right about a child, I didn't ignore it. And you may be right, you may be wrong, but in that situation, in primary care, in a GP setting, having the ability to trust your gut is a really powerful thing, because with pediatrics, you do not want to take any chances. So trust your gut. I learned that from my pediatric rotation, and I'm sure you will when you do it as well. The 7th thing that I took away from my pediatric rotation, this might not seem an important one, but deep down it really is an important thing, is that I got to look and listen to and examine lots of normal things to try and understand what is normal. It's very easy to spot something that's wrong, but to be confident to say that's normal was something I picked up in my pediatric rotation. Again, of course, for adults, different story. I've been doing this throughout medical school, I've done it in other rotations, I examined lots of things, but I hadn't examined a lot of normal ears in a child, for example. I hadn't examined a lot of normal throats in a child, for example. I hadn't listened to a lot of pediatric cardiac heart sounds. I didn't listen to a lot of adult heart sounds, but listening to a child is slightly different. So one thing I took away from my 4 months is every time I saw or heard or examined something normal, I tried to kind of stick it in here as adding it to my baseline, so that when I examine something that's abnormal, I'm able to pick it up much quicker. Remember, for adults, I probably started to pick up this skill already, but for pediatrics, you're starting at baseline again with a lot of these examinations, and that's something that I took away that, again, hugely helped me when I started seeing pediatric cases out in the community. And the final thing I took away from my pediatric rotation, this may seem a little bit an odd one, is that I actually learned how important it is to get on a level with somebody, have fun, understand what TV program that is on in the middle of pediatric A&E, look at some kiddies' books, play a couple of games with kids. And these are games I hadn't played with a child for many, many years. I hadn't been a child for many years myself. So I was out of touch, but I got to learn so much about all these characters from all these TV programs and all these superheroes that I'd just forgotten about. And I just learned to have fun. When you are assessing a child, when you're in it with them, when you're having fun, when you're kind of mixing examination with talking about their superheroes, it just means it's a much better experience for a child and ultimately a much more valuable experience as a doctor as well. So one thing I learned was the important, you've got to give a little bit to a child if they're going to give something back to you. Talk about what they like to watch. Talk about what they like to read about. Talk about their most favorite game. Talk about, what's current at the moment, what's hot at the moment, what's on topic at the moment, what's on trend at the moment, It's just something that I really learned in terms of engaging with children is very different, of course, to engaging with adults. And you've got to give a little bit to them first, build up a little bit of trust, and then they'll give you what you need in return. So I learned that across my 4 months, and I was a different doctor with children at the end than I was at the beginning. And I certainly knew a lot more about games, toys, characters, TV programs by the end of my 4 months. And it really helped when I jumped into my next rotation. So guys, thanks so much for watching. I hope there's been some value watching those 8 things that I picked up from my own pediatric rotation as a GP trainee. We're going to do so many more videos about my other rotations, what I found useful from them as well. So they should be coming out very soon. If, like I said, you're looking for PDPs for your pediatric rotation or any other rotation in GP training, have a look at the website, auroramedicaleducation.co.uk. Go to the blog section. There's loads more in there, not just about PDPs, but also about GP training in general. And if you're watching this on YouTube, please do subscribe. If you're watching this on our Facebook page, please do like. And if you're watching on our Instagram feed, please do follow there as well. We've got so much more for you to come. Of course, GP training exams, we have online courses, audio courses, face-to-face courses, and so much more teaching for you to get you through AKT and CSA as well. Hope this helps. Hashtag can pass will pass. Hashtag I went with Aurora. Have a good day.